UroPatient, tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hi, everyone, and welcome to today's episode of UroPatient. I'm your host, Vic Senese. Today, we've got an incredible discussion lined up with Dr. Jeff Albaugh and his guest, Dr. Kristen Farling, certified urology nurse practitioner. They're diving into a topic that is both important and misunderstood. Injections for erections. We'll explore how these therapies work, who can benefit, and what patients should know about using them safely and effectively. It's an honest, educational conversation that's going to shed light on options many men didn't even know existed. So I'm going to let Jeff and Kristen take it away, and they're going to explain everything you need to know about using these injections.
What an amazing thing to be a part of these patients' journey. And certainly injections aren't for everybody. We're not saying that. But for the right patient, it can be life-changing, and it can be something helpful. I never push anybody into it, but I do find that once they do it, it is one of those treatments that they're like, wow. But 20. So you can use all different doses, but they come in 10s, 20s, and 40s. I'm going to show you how to prepare that. But edex.com has an excellent patient training video. You can see that at the bottom of the screen, edex.com. They have a training video that shows you exactly how to do this from start to finish. And they have a training sheet that you can print out. It's a patient instruction sheet that you can print out. But while we're here on edex, I'm going to go ahead and show you step by step how you do this in just a second. And then when we get to the other mixtures of Bimix, Quadmix, and Kristen talks about that, she's going to show you how you would draw up that medication. But first, let's just show you a little bit. So with this one, this is called Caverject Impulse. It's a really interesting product. So what you do with this one is you have a needle that goes on the end of it, and it comes with it. It's a one-time use thing too, but there's a needle that screws on to the end of it like that. And then now you have a single use needle, and then you have this device. When this device, you go through the steps, and you can go on the Caverject website and look at how to do this as well. And when you screw this in, it will force the liquid and powder together. When you push in, it pushes it so the liquid and powder mix. And then there's a little, you can hardly see it, but there's a window right here. That window will show the different doses, 5, 2.5. The 10 microgram has 2.5, 5, 7.5, and 10. The 20 microgram has 5, 10, 15, and 20. And you roll to your correct dose. And then once you're all ready, the needle is here, and you give it to yourself in the penis, which we'll show you later, and you push the medicine in with the plunger. This is the plunger here. So that's Caverject Impulse, and they have a wonderful video that shows exactly how to do that if that's what you've been prescribed, and one-on-one, your prescriber will teach you how to do that. Now, edex is a Tubex system, which nurses are very familiar with. This is called a Tubex, and this blue Tubex, when you're trying to remember, what do I reuse? This is what you reuse. This is the reusable part of edex, okay? And so what you do is you have this. You're going to set this down for just a minute while you prepare. You have 2 alcohol wipes. There's 2 of them. You have a needle, and you have a cartridge. Each time you want to give yourself this drug, you have a new needle and a new cartridge, and they're one-time use only. So, and they're inside here, and they're sterile. So what you're going to do is you're going to open this package, and how you're going to do that is one of the ends has a little paper tab, and you're going to pull it across like that to open it, and now we've got everything inside. There's a needle in here. The needle has a little paper tab over it, and it should be intact. We're going to pull the paper tab off. There's a needle on this end, and there's one underneath here that you're going to inject into yourself. But this needle is going to pierce something in this. So this is your needle, right? And so, but You're going to use that in a second. And actually, when you watch the steps, the first thing you're going to do is you're going to take the cartridge out. You're going to clean it with your alcohol because there's a little stopper on the end that is going to be pierced. That's why I wanted to show you the needle first. But that needle has a needle on both ends. The needle will pierce this cartridge so that we can deliver this to you. Take out your alcohol wipe and wipe that little stopper on the end of your one-time use cartridge. This has the drug in it. See the liquid down here at the bottom? That's liquid. You can see that liquid, and you see that little bubble at the top. And this powder is the actual drug. So now what you're going to do is you're going to load this into your reusable Tubex system. So you're going to unscrew this. Okay, let me show you again. So here it is screwed together. And so what you're going to do is you're going to unscrew it. Yep. And now we have the two pieces, the plunger and the part that you're going to load the cartridge in. You're going to take your cartridge, and there's a little notch on it. It may be hard to see, but it's right there at the top. See it? And we're going to line up that notch with the groove. I just put the groove on top and the notch is on top, and that notch and groove, it'll slide right in. If it's not lined up, turn it till it is lined up, and it'll slide in. I like to take my finger and push that against that, push that down in there so it's in there. And then now we're going to put the plunger back on this end of it like this so that that's together. On this end, we have what we've done. What we're going to do now is now you would tear the paper tab off of your needle, which should be intact, right? You've already cleaned this. And now we're going to screw that needle onto the end of this device, okay? When you're doing this and you're doing it in order, I wanted to show you the pieces and make sure you understood it. The first thing you're going to do is you're going to pull off the paper tab on the needle and screw it onto this reusable thing, right? So you're going to screw it on here before you put the cartridge in so it's ready. So let me show you the steps again one more time, and I'm going to show you step by step how you'll do it at home. So you got your needle and your cartridge. So the first thing you're going to do is you're going to take your needle out of here. You're going to take pull the paper tab off, and all this is on edex.com, and you're going to attach it to your reusable plunger, right? And your reusable plunger is not taken apart yet. It looks like this, and it's the blue thing. This is what you're loading on when you remember it's blue. Screw it on here till it can't go any further. You got it on there now. Okay, it's screwed on. Now remove the other end because we're going to insert the cartridge in there after we clean it. We clean it with a alcohol wipe, and we line up the notch and groove, and we push it in there. Now look, if we give it a little push, it's going to go right up against the needle. Even if you don't, when you put this plunger back on, if this is in your way, drop it out of the way. When we screw the plunger back on like that, now it becomes one piece. Plunger's in place, medicine's here, needle's on. So we put the needle on first, we cleaned the cartridge and loaded it in and put it in, and then we reapplied the plunger. Okay, that's how you put it together. It's all listed in the patient instruction steps, and it's all on the video. So watch that. Very, very important from edex.com. Now, we've got liquid and powder, but we have to blend the liquid and powder together so it can actually be injected. It's not mixed yet. That's why this doesn't have to be refrigerated or frozen, because it's not mixed yet. It's still powder and liquid. It has an expiration date on there. Make sure you check it, but your drugs have an expiration date. And then now you're going to mix it fresh right before you give it to yourself. So when you push straight up on this, I'm going to push on this, and it's going to force the liquid and powder. See how the liquid and powder have merged together and the two stoppers touch right here? Two stoppers touch together, and the liquid and powder are now together above those two stoppers. And you're going to mix it by gently rocking it back and forth. You can roll it between your hands, rock it until it becomes completely clear. That is your medicine. And so you're gently rocking it till it becomes clear. If it doesn't become clear, you're not probably going to want to use it. And then you're also going to want to get all your bubbles up to the top. Flick them up to the top. Once you've got all the bubbles to the top, now when you push up, the air is going to come out and all the bubbles will come out because the air is lighter than the liquid. To do that, we're going to take the outer cap on. Now, in the instructions on edex.com, it'll tell you to take this off, which you can, absolutely. But I have my patients leave it on because the air and the liquid will come right around it, and this will protect the needle when you set it down before you give it to yourself. So you could leave the pink cap on and the air and liquid will come around it. If you don't leave the pink cap on, your needle is exposed, which is okay. Don't let it touch anything. No surfaces, your finger, nothing. But if you leave it on, it won't touch anything. So I tell you, one exception to what they teach you online is to leave the pink cap on until you're ready to inject it because it will protect your needle. Push straight up now, get all the bubbles to the top, push straight up like you've seen in the movies to get all the air out. And you can see the little bubbles, the liquid, you probably can't see it that good, but the little bubbles up there next to it, see them next to the needle right there? It will come right around that cap, and that cap will protect the needle so that it's not exposed. So and then push up to your dose. There's little markings on here, and work with your provider on getting rid of the medicine. If you're using half, you come to the 0.5 mark. If you're using a quarter, you come to the 0.25 mark. So here I'm going to pretend like we're using 3/4, and I'm going to come up, and I'm going to waste the extra and come up to the 0.75 mark. Okay. So that's what I did. Now, that's how you get the medicine ready. Now the medicine has been, so there's the main steps are assemble it, put the needle on, clean and load the cartridge, reattach the plunger, assemble it, mix it, powder and liquid, so it becomes liquefied. When the two stoppers touch, mix it back and forth, and then get all the bubbles to the top, push the air out, and get your correct dose. And now it's ready to go. Set it down until you're ready to inject, and we'll show you how to inject in a minute. Okay, there's lots of steps to that. I know, and that can be overwhelming, but all the steps are listed on the patient instruction and all of them in the video. They will become second nature, but you've got to, that's where your partner can come be really helpful because they can read them off to you, but you've got to double check yourself each step of the way. And this is always done under supervision the first time in the clinic. So you know how to do it, and you know how to do it safely. There's a patient instruction sheet and a video on edex.com. It's a lot of steps, but you get the idea. Okay, now that was long, but now we're going to go over to the Trimix and Bimix and Quadmix. So let's go back. But since the 80s, here's what we've had. And I alluded to papaverin. Papaverin and phentolamine is Bimix. Trimix adds in the PGE1, which you just saw was edex. So now we have 3 drugs, including the FDA-approved one, mixed together. And that's so that we can minimize side effects of papaverin and phentolamine and maximize efficacy using 3 agents instead of 1. And then the other mixtures, the super trimix and quadmix, which are just stronger versions, super trimix, of the same 3 drugs. Quadmix adds in atropine. I rarely use Quadmix, but there are people out there that do. I don't find atropine to be a great agent, and sometimes I think it affects sensation. Do you use Quadmix at all, Kristen?
Very rarely. If a patient was coming to see me who was already on Quadmix, I will continue it. But if they're, I don't use Quadmix. If they're not having success with Super Trimix, and the nice thing about these compounds is you can increase these individual agents. The Super Trimix might be 3220, like this slide says, or it might be 3240, or you might be able to increase the phentolamine by a little bit more. So you can kind of increase them a little bit more individual if you are able to. But the Quadmix is, it's.
So we don't use it. The only time I use it too is if somebody comes in on it. I'm not going to change what's already working for you and not causing you any problems. Same as you, Kristen, exactly. So there's nothing wrong with Quadmix, but across the world, the most popular is the Trimix and Super Trimix you see here, but they can be tweaked a little. Papaverin at 30 is maxed. We don't tweak that. We don't go up on it. We can go down on it though. We can go down on any of these agents. On the mixtures, we can go up on some of them. So they can be customized a little bit sometimes, but all this is done prescription, non-FDA approved through your provider and under supervision. So next, why don't we go to Kristen, and Kristen, just show them. Now this is going to look, I'm going to tell you right now, this is a lot simpler because this is a multi-dose vial, just like insulin. And all you're going to do is draw out your medicine each time with an insulin syringe. You don't have to mix it, but because it's pre-mixed, it has to be frozen or kept cold at all times. The Edex and Cat Reject are mixed fresh right before you get it, so they do not have to be refrigerated or frozen. They can be kept at room temperature. This one does because it is already mixed and ready to go. But the beauty of that is, you're going to see in a minute, very simple to get it ready. You don't have to mix it and do all the things I just showed you. So Kristen, take it away.
Yes, and it's interesting that they, looking at these like syringes, this is, there's so much technology nowadays, right? You have like the insulin, which is the insulin pen. You have like the GLP-1s that are like a pen. They're so like fancy. These are not fancy. These are the old fashioned ways, but if it's not broke, don't fix it. All right. So this is what an injection looks like. So you're going to get a bottle. It's just like a regular old bottle from the pharmacy. And this is usually about 5 cc's. That's the maximum dose of medication that you can use, typically from the compound pharmacies. They will also give you a syringe. This is just an insulin syringe here. And you can see that this syringe here goes from 0 to 100. So it goes, lots of room to improve if we need to. So this goes from 0 to 100. And I'll tell patients, it's okay if you use 70, if you use 80. Like, we don't know what your dose is going to be, and that's perfectly fine. But we always start off at a low dose. Maybe we'll start off with either 5 or 10 in the clinic just to see how you respond to it. But then you can increase it at home until we find the dose that works best for you, which is very, very good. We don't want to increase it more than 5 units at a time. So we do want to go slow. So I always tell patients, be patient. Be patient with this process. Like once you've learned the injection, that's kind of the easy part. The next part is being patient to try to figure out what dose works for you. And let's say your first dose was Alprostadil, and you use a certain amount and it wasn't working, and then we changed you to Trimix. So we kind of tell patients in advance that just be patient. It may take some time, but we will find the dose that works best for you. So this is a syringe. This is kind of what it looks like. And just like what Jeff said, you're going to have the bottle. Make sure it's always clean with alcohol. This bottle here can be reused. It's usually a 30 to 45 day use for this medication. And then you'll get your syringe. So this syringe here, because this bottle, to get the medication out, we want to put air into it first. This is vacuum sealed. So let's pretend your dose was 20. Your dose was 20, so I'm going to get my syringe. I'm going to pull back on this white plunger until my black line is at 20. So now I've got 20 of air. So I'm going to go ahead and put that 20 of air right into the bottle, inject the medication or inject the air, turn the whole thing upside down. Very, very simple. And then you're going to go ahead and pull back until we get to your dose. So let's say your dose was 20. So now I have a little bit more than that, because just as even what Jeff said before, you might have air bubbles in here. So we want to get those air bubbles out. So what we'll do is we'll flick this a few times, just like what Jeff said. We'll make sure after we flick that a few times, we go ahead and squirt it just until we see some of that liquid come to the surface, so that we know, you might have been able to see that liquid come to the surface, that the air is gone and we have our right dose. So that's what an injection looks like with the compound medication. It is pretty simple. It is pretty simple. But this here, if you're looking at it, I'm just trying to find if I can get a little bit of a background. Maybe not. The needle itself is so skinny. You can barely even see it from this angle. It is just a skinny needle. And it's usually a 1/2 inch. We can go a little bit shorter, but this is a typical size and length. So it's very, very fine. So that means you don't feel it very much at all whenever the needle goes in. So that's what the compound medication looks like. You do have an individual syringe. The syringe you throw out, you do not reuse the syringe. And just like what Jeff said, if you're drawing up the medication's cloudy or has many particles in it, we don't want to use it. We want to make sure we have a nice clear fluid. But that's the simple version.
Side effects. So pain, yes, you can. The drugs themselves, especially the prostaglandin E1, can cause some pain. And so the drug can cause some pain. It can cause a burning type pain in the penis. About a third of patients get it. We don't know who will get it with the PGE1, but if you get that, it can be taken out. That's why we would use a Bimix. Instead of using 3 agents, you could use 2, or you could switch over to the Trimix to use less of the PGE1. But pain and burning are mostly associated with Alprostadil, which is prostaglandin E1. You can also get, of course, bruising and bleeding, right? And we're going to teach you that to press for 5 full minutes afterwards, especially if you're on any anticoagulant like aspirin or any anticoagulants to thin your blood a little because of other issues. Even if you're not, you want to press for 5 full minutes. And I'll show you how to do that in a minute, because you kind of encircle the medicine as you're pressing to keep it local, and you can reduce bruising and bleeding. Redness, swelling at the injection site, priapism, which is a serious condition. I know you might be thinking, wow, it would be great to have an erection that lasts 4 hours, but I'm telling you, it is literally a medical emergency. Because think about it. Your penis is really hard. The blood is no longer moving back and forth. You need oxygen and nutrients to move back and forth. And so, Kristen, talk a little bit more about this. I'm going to grab my plug so that this doesn't turn off, and I'm going to let you talk more about the side effects while I do that.
Sure thing. I think with the Alprostadil, the single agent, sometimes you can have, what Jeff said, you can have some burning with that. That can sometimes cause some pain. So I usually tell people, if it happens, not a big deal. Don't worry about it. We'll just adjust the medications. We'll adjust the ingredients. It's purely fine. With priapism, it can happen, but whenever we go at a very low dose and work our way up slowly, we really do minimize that from happening. Now, we do have some patients are very eager, and they'll increase the medications higher than what we recommended, or there might be medications that will combine it with Viagra or Cialis. So we don't recommend that. Sometimes we do, but we will tell you that. But most time these are single agents, and if we add another medication on it, the chances of you having a prolonged erection are going to be higher. And what Jeff said is, it is a medical emergency. If you think about it, if you have decreased oxygen to that part of your body, that's not healthy. If you have decreased oxygen to your heart, you have chest pain, and that's a medical emergency. If you have decreased oxygen to your penis, you have penis pain. And then we have to reverse that, because you want to be able to use your penis in the future. You don't want to cause permanent damage to the penis. So we always tell these patients this, and they get very scared, like, oh, I don't want to do injections at all because I'm afraid I'm going to get priapism. We tell them this so that they do not increase the medication higher than what we recommend, because this is a very safe medication when given and when administered by a provider who knows this medication. So sometimes we do try to scare you a little bit, but that's for your own protection. But if you're doing this under our local, or if you're doing this under our observation and under our recommendation, the chances of these side effects happening are minimized.
And that's why you want to work one-on-one with a skilled provider. But so we start low, we go slow, and you have to start low and go slow. We tell you to go up by 1 or 2 units with the Trimix and Bimix, or 1 or 2 micrograms or so with the Edex. We go up very slowly because we don't want priapism. And if we do that, we're usually pretty successful with avoiding that problem. And we literally will give you instructions to take to the emergency room, and they will help you. If you have an erection, even that lasts 2 hours and is very hard for 2 hours, you can go ahead and go get treatment. And the sooner you get treatment, the easier it is to give the antidote or to bring it down. You can imagine if you fell asleep with it, it could be very dangerous because the blood is literally trapped in there and it starts clotting. It can be a very serious situation and cause tissue damage and death. But that is quite rare because if you do it correctly, really carefully, and you slowly titrate, it should go well. And if you have any problem, you go to the emergency room, they will give you the antidote and resolve it, and you'll be okay too. So we do put a little bit of fear in you because it's so important to address it because we don't want to cause any damage. Safety is always our very first and foremost important thing. So that's why. And then scarring or curvature. So that's why we say once in 24 hours, 3 times a week max, because we don't want to do too many injections. We don't want to cause scarring. We don't want to cause problems. So we do a lot of things to minimize these side effects. And like you, Kristen, I've had men on these drugs for years with none of those problems for many years, decades, in fact, right?
Yes.
But the thing is up to about 10 to 15% can get a priapism or scarring, possibly. It's a little lower with prostaglandin E1 as a monotherapy, but under the right supervision, it doesn't happen that often. And if it happens, we tell you exactly what to do. So you'll have all the information you need either way. But these are important things to talk about, and make sure you have that. We give you a little half sheet of paper, and I'm guessing you do something similar, Kristen, that you bring with you to the ER so anyone knows exactly how to help you resolve it immediately. You should not be sitting out in the waiting room waiting with that erection. You need to be taken back in and treated because it's considered a medical emergency room, a medical emergency if it were to happen. And again, many men, it will never happen, but you still have to know what to do in case it happens because it's a serious thing. And so is scarring. We don't want scarring on the penis. So those are important things. And they don't happen very often, but you still have to know they can because they do sometimes and what to do if they do. So let's advance to the next slide, Vic. So how do we do all this? You come in and first we usually give you the information to read and study and prepare yourself. And then we have you come in with the medication, your own medication, ready to do it. Some clinics may have the medication on hand. We typically have you bring your own medication in. So you're working with your own vial, your own syringes, and that's how you do your first injection in the clinic. But either way, you do that in the clinic. You do it just like you'll do it at home. If your partner's going to do it, then your partner does it there. If you're going to do it, you do it there. Whoever's going to do whatever, have them do the same thing in the clinic so that you've done it once and had a success already with a very low dose to start with of whatever your agent you're using. And then we'll tell you next, try this dose. And then typically you'll go up by very small increments till you find the correct dose. While you're trying to find the dose, you'll probably use it once in 24 hours, 3 times a week until you lock into the right dose. And then you only need to use it when you want to have sex. But in the beginning, you may use it a little often, more often, no more than 3 times a week, once in 24 hours. But you want to find that dose and figure out what it is. But as Kristen said earlier, once you figure it out, you know exactly what's going to happen. It will last usually the same amount of time each time. You know how long it's going to last. You know exactly what to expect because it tends to be pretty reliable. Once in a while, you may miss and hit a vein. Usually that just means you didn't get an erection. Wait 24 hours and you can try again. But so you study the written information. You watch the videos if you're using EDEX. You read over everything carefully, and then you come in the clinic ready to try your first dose. Let's go to the next slide. And then you try it in the clinic. Now, how do you do it? So you can see there, you're going to grasp the penis by the head. If you have a foreskin, you're going to push it completely back so you can grab the head. Because if you accidentally stick the needle in the head of your penis, you are not going to be happy with your provider. It is going to be very uncomfortable. we do not give this drug in the head of the penis. And that's why push back the foreskin, grasp the head firmly, don't twist or turn. And I'm going to show you this in just a minute with the model, and then give the injection. We tell you to give the injection just like you drive at 10 and 2. So on the side. So if this were your penis, my finger were your penis, this would be midnight, and you would give it at 10 over here at 2 o'clock, or you'd give it at 10 o'clock. This would be midnight. Some people do down a little bit straight in at 3 o'clock or straight in at 9 o'clock, and that would be okay too. But you don't want to angle into 3 or 9. If you're angling, you should be right at 2 or 10. So, and then let me show you on the penis. So here's the penis model, right? And so here's midnight in the middle, right? Here's 10 o'clock over here, and here's 2 o'clock over here. So here's midnight, 1, 2. Here's 3 o'clock, but you go straight into 3, or you go here at 2. Here's 10 o'clock, straight in at that angle to 10. But if you're going to do over here, then at 9, then you're going to go straight in, because we don't want to get down here in the urethra. The urethra is on this bottom side, and we don't want to go into there, because then the medication and blood will come out the tip of your penis. We're shooting into the corpora cavernosa, these 2 cylinders, not the blue, but these cylinders on each side. So here's the penis again, and we're shooting into these very vascular areas on either side. Here again is 10 o'clock. Here again is 2 o'clock. And see, we're shooting into that white cylinder, which is the corpora cavernosa. The corpora cavernosa on each side, and we rotate sides so that we don't go in the same spot all the time and get scar tissue. And you can go anywhere along here, from next to the base of your body to down here. Don't go down by the head of the penis, but you could inject anywhere in this area, on the other side, anywhere in this area, and at 10 o'clock or 2 o'clock, if you do 3 and 9, straight in, don't angle, straight in, but that's how you give those injections. And so, and again, one more thing while I'm showing you that. Here's your needle. How far does the needle go in? Okay, the needle is meant to go in up to the hub. This is the hub. So after you clean the skin with your alcohol wipe, so you have your second alcohol wipe. This is why, because you clean the skin with your second alcohol wipe. And now you've got your medicine all ready to go. It's drawn up and ready. And now you pierce the skin and you go all the way in. Look at that. You don't see part of the needle. You don't see me pushing too hard. It's just into the hub. And then you hold it between your fingers as you push the medicine in. You don't, if you push and pull, you'll pull the needle out. Hold the needle completely steady as you push the plunger all the way down to instill all the medicine. When the medicine is instilled, you can remove the needle and take that same alcohol wipe and press by putting your fingers on one side and your thumb on the other side. Fingers and thumb. Or you can do thumb and fingers. Either way, but encircle it with your fingers and your thumb, pressing over that injection site for 5 full minutes. So pressing that injection site for 5 full minutes. Okay? And that's how you do the actual injection. Remember, the needle goes in up to the hub, so you don't want to be pushing too hard where you're pushing the hub down into the skin, and you shouldn't see part of the needle. It should be all the way in. And so that's how you would do that injection. And again, your provider will show you exactly how to do it in your particular case, but that's a general guideline. Okay. So remember, you got to figure out how you're going to hold the needle. You could hold it between all your fingers, between these 2 fingers, but you got to steady it and hold it steady once you get it in, and then you got to have something to push with. If you hold it this way, you could still push with your thumb. You could do it this way. Some people like to push with their index finger and hold it between. You figure out what's comfortable. I find this most comfortable between these 2 fingers, sort of like, I guess you think of a cigarette, and then hold it steady and push. So, but you could do it whatever way you find comfortable, but you got to hold it steady as you push the plunger. Back to the thing, Vic, again, don't twist the penis. Sometimes as you're doing it, you want to twist, and then you'll get down here in the urethra. So just hold the penis steady and you can kind of hold it against your thigh. See how it's straight? And now we can go straight in. But if you twist, you're going to get down here in the wrong spot. Again, if you hold it steady, fine, and put it up against your thigh, but don't twist it as you turn, because now you'll get down here into this yellow area where you do not want to be. That's the corpus spongiosum, where the urethra is, where the urine comes through. Okay. It's a lot, I know, but hopefully it all makes sense. All right, let's go to the next slide. We've taught them how to do the injection. Anything else on that, Kristen, that you had?
I think some of the things, just to kind of reassure men, is that sometimes they'll look at that needle and they'll be like, that needle is going to go right through my whole entire penis. That needle is so long. You're not going to go through the penis. So I always try to like reassure them that that's a very common, thought that men have. It was, very reassuring that, that's not going to happen, but that needle length is there for a purpose, the ½ inch, kind of just reiterating that. And also just making sure that you're looking at the anatomy each time, because you want to avoid the veins. So if you're like, hey, listen, whenever I was in the clinic and I injected here with Kristen, that might not be the same injection spot that you're going to go to later on. Depends on how taut you have the penis, or kind of like how you have the penis is. Always look right then and there whenever you're injecting yourself, just to make sure that you have the correct anatomy. It sounds harder than it is. It's not. But we're just providing lots of information.
We are. And so like veins, you can see the veins in my hand. You can see veins there. You have veins on your penis. If there's visible veins, avoid them. And then give them in the spot we teach you to do it, and rotate the spot so it's not the same spot constantly. You can go on the right or the left, and you can go anywhere along where we showed you. So, and then apply 5 minutes of pressure after you swiftly remove the needle by encircling the penis like we showed you. We've showed you a lot of information packed in this one. Let's go to the next slide. We talked about the direct pressure. We talked about avoiding the visible veins. We talked about not twisting and rotating. We've been through these guidelines, Kristen. That's good. And so the 10 and 2 is where you use the angled approach. If you do 9 and 10, you do the straight in approach on the penis. So we do straight in at 9 or 10, and we do angled if we do the other. And so we showed you syringes and needles, whatever it is, whether you're using the kit, which is the Edex, or the kit, the Caverject, one-time use only, or whether you're using the insulin syringe, one-time use only with a multi-dose vial. No more than one use in any 24-hour period, even if you don't get a full erection, and 3 times a week maximum. That's what the guidelines say in the patient instructions from the FDA as well. And follow your provider's guidelines. And lastly, pain. So you're thinking, you say it doesn't hurt, but what do patients say? So don't listen to Kristen and I, because we can only tell you what patients tell us. But this is the study I did, the first study to look at pain. And what we found was 40% of those men who did the injection right after they pulled the needle out, we said, rate the pain with the needle 0 to 10. 40% said 0. I felt it go in, but I literally had no pain. Of those who had any pain, the average pain rating, remember, was 1.33. So 1 or 2 out of 10. That's a very low pain rating. So most men found it virtually pain-free or not very painful. Interestingly, the patients who had their partners did it said it was more painful from their partners in some of these studies than themselves, maybe because they weren't controlling it, which I thought was kind of funny too. Mm-hmm. But in general, whether your partner does it or you do it, most men find it a very low pain, if any pain, from the needle stick.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your help for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.